Since Chris isn't here. See if you can close the door, Vaughn, would you?
I need your whistle, Dietrich.
No. See if you can take a seat or whatever, kind of slow down. I know you guys heard it all before, so. My name is Dietrich Klinghardt, and I'm an MD from Seattle now, and I work very closely together with several dentists, and we have that team approach. And today our main focus will be to show videotape of a healing of a patient that came to us in the wheelchair after many years of struggling with MS. And we show how this patient really within a few days went from wheelchair bound to being able to run for 1.5 miles. And I think some of you who have your minds open a little bit are going to see in that movie all the steps that we've been teaching over the years. And I want to lead you into this with just a couple of introductory words. I've been running the Academy of Neurotherapy, which is a similar organization to this, or really like a sister organization to this one. In the Academy of Neurotherapy, we teach 3 things. We teach a set of injection procedures referred to as neurotherapy, that involves injection in the mouth and the diagnostic workup that the dental does, diagnostic local anesthetic injections in the jaw. You will see that in the video. They're part of neurotherapy. Then the teaching in my academy also includes a complete course in teaching a technique called autonomic response testing. Autonomic response testing is, in my opinion, the highest evolved form of muscle testing. It incorporates many of the techniques I've learned in electroacupuncture, pulse testing, tomography, and kinesiology. It looks like muscle testing, but the actual steps built into the system are very, very advanced tests from neurology and from many alternative techniques. That's the second leg that we're teaching. And the third thing that we're teaching is a treatment addressing the psycho-emotional underpinnings of chronic illness. And this technique is called applied psychoneurobiology. And so it's a series of a total, there's always a basic course and an advanced course in each of these 3. And the flyers, we have a table set up outside, and my nurse, Andriana, is here. Annie, would you mind standing up for a moment? Yeah. So some of you who haven't worked with us and who are touched by maybe what you hear or see, you can check out with Andriana like the schedule for this year. Some of you may want to take some workshops in this. Here's the theory of that I developed sort of over the years. I call it the 5 levels of healing. And this applies to dentistry, acupuncture, it applies to any kind of school of healing. The bottom is the physical body, the thing that we can touch and scratch and smell. And there's certain healing techniques that apply to the physical body. You know, whenever you put the dental drill in the mouth, that's working mainly on the physical body. Or when we take supplements, vitamins, drugs, medications, that's physical body stuff. Chiropractic, osteopathic, when you move bones around, that's the physical body. But then beyond that, we have a body that extends into space, which I refer to as the electromagnetic body. It really is the 4 forces in physics: strong force, weak force, gravitation, and electromagnetic. Creates a force, a field that is highly structured, has its own anatomy, its own physiology. The autonomic nervous system is the lowest frequency, so to say, in that, the lowest level of that. And the healing techniques on this level are outlined here. Acupuncture is probably the most well-known and the most effective technique, without a doubt in my mind, is neurotherapy, which is using local anesthetics instead of acupuncture needles, and injecting, rather than injecting acupuncture points, we inject the autonomic ganglia and autonomic nerves. Many of the points are identical to acupuncture points. In the video, you will see how my friend Dino is in this patient wisely using neural therapy at appropriate points in the treatment, making dramatic changes in the functioning of this patient. The third level of healing is the mental body. We call it the mental body. This is the home of psychology, where all our unresolved psycho-emotional material makes a disturbance in this field. It's a huge field around us. There's been studies on that. It's been measured. There's one experiment where you put somebody on an isolated chair that's isolated from the floor and put EEG electrodes on a copper plate on the wall 10 feet away from the patient. And you can read the patient's EEG on that wall without any amplification or any other thing. That means the mental field, the field generated by the mental activity, is huge. The techniques that we have available on this level is homeopathy works on this level, and psychotherapy. Those are the two big things that work on the same level. Most people don't believe this when they first hear it from me. Most all homeopaths, a light bulb goes on and say, oh, that's why I'm seeing all these psychological changes when I treat somebody over months and years with homeopathy. You will see in the video how Dino's wife, Dejay, and Dino himself, the way he's approaching the patient, is modifying and altering the mental body, accessing old psycho-emotional material, and making huge changes in the further healing of the patient, all in one session. And you will see him going fluently forth and back between taking teeth out and doing psychotherapy, all in one session. But when you see this, you'll understand when you see the video later where the patient and the physician are going to be. Then beyond that is the fourth level. That's the level where the psychic stuff happens, like spirit possession, dreams, all the weird psychic stuff that you read when you read Carlos Castaneda or some of the more groomed sort of psychotherapists dealing with parapsychology or transpersonal psychology. That's the level of that. And we use a technique called family constellation therapy on this level, which is highly, highly effective. And again, it's something I teach in my psychological courses. There's other courses available on that, to have a reasonable, simple approach that can be done in the office on a one-on-one relationship. And then the fifth level is the relationship with God, which I feel, and this is sort of like a criticism on my fellow Americans, the Americans are way too easy to disclose what their relationship is with God and brag about it, what they know and how they're communicating with God and what they're doing. I feel it's a very sacred and private place that should not be a topic of public discussion. And this is also a place where no healer has anything to do. This is completely personal between the patient and God, however their relationship is established. All spontaneous healing comes from that level. So, I don't know, does this microphone work here too? Yeah. Oh, it does work now because it didn't work a few minutes ago. Okay, so this is, we call the 5 levels of healing. There's an interrelationship, which is that all the higher levels have an instant and penetrating effect on all the lower levels, whereas the lower levels have a very slow upgoing effect on the higher levels. That means if you have a psychic injury, somebody curses you, a mother dies and on her deathbed she says, I hate you for the rest of eternity, that's probably going to have an instant effect and give you cancer and other things, which is the manifestation on the physical body. However, if you have a car accident and get your collarbone broken, it may take years or never happen that this affects your energy system, the next level up, or your psychology, or even the higher levels. Yeah? So there's an interrelationship. And this interrelationship also predicts that if we do a healing technique on the mental level, up here dealing with the psychology of the patient, or giving the right homeopathic, it may have a rapid and penetrating effect on the physical illness. Whereas if you give the patient antibiotics, which work on this level down here, the patient may never get well. Yeah? So this is the relationship, and explains a little bit why we do certain weird things, weird-looking things first, and the antibiotics last, and not the other way around. Good. I want to show you a couple of tools. A wonderful tool that has emerged in the last year is this one here. It's called the Functional Acuity Contrast Test. Now, those of you who don't know this test, you have to buy this test. What this does is, first of all, is a test developed in McGill University that we just heard about, a good reputable thing. There's about 200 peer-reviewed studies on it. They all show when a patient becomes loaded with neurotoxins, that the first function that goes in our system is the ability to distinguish contrast, to distinguish between gray and other gray shades. And this test is based on that. And I'll show you how the thing looks like when you actually do the test. This is the patient that we want to show you in the video in a minute. What the patient is presented with is, I can show this. This is a plate that has little gray lines on it with different shades of gray. And the patient is holding this and simply has to say which way these lines tilt. And then we see how much of, and the contrast is getting less and less as the patient goes to the right, and these little pictures on there. And the patient gets a score that looks like this. Like when a patient can distinguish contrast really well, these points up here would be crossed out. Now, in the right eye, the patient has these readings here that are in the low range of normal. And in the left eye, the patient drops out of the normal range, is not perceiving contrast properly. This test is identical with the diagnosis of chronic neurotoxin-mediated illness. It's in the peer-reviewed literature, is widely accepted in neurology as a diagnostic tool, and is predictive of Lyme disease. We can make the diagnosis of Lyme disease just based on this test. Now, this is a patient with MS, and an MS patient who has these readings is identified as this is MS, where the initiator of the illness was a neurotoxin or a group of neurotoxins. And so when we take what the previous speaker said, we can identify now in the blood if there is stealthily behaving microorganisms in the system, but we don't know, now I'm talking as Gitte, we don't know if these microorganisms are really causing illness or not. And I'm proposing to you, we have a tool now that we can show within a 2-minute test, it takes 2 minutes to do this, but the patient in fact has pathology based on these microorganisms. So it's a tool that costs about $250. I suggest you buy it from a website, because then it supports a person that has done great work with this. His name is Richie Shoemaker, and the website is www.chronicneurotoxins.com, and you can buy it from his website and read everything, then you know as much about it as I do. It's one of the tools we're using now, other than muscle testing or EAV, that has widely found acceptance in the scientific community. In terms of making the diagnosis, those of you who use muscle testing or EAV, we've completely gone away from using ampoules. What we use is a method where we're using, this is an actual microbial culture that you're looking at of Rickettsia rickettsii. This is an agar-agar plate, and it is vaccinated in these bright spots with this particular microorganism. And we found a photographic method of taking the culture plate and making a very high resolution photograph of that, and we can use that for muscle testing or for EAV testing, far exceeding the accuracy of whatever was possible with the homeopathic dilutions or other methods that we've been using. Those things, I'm doing a little PR here. We're selling in my academy. We took years to put this together, to find the right cultures and to find the photographic method to go from a culture, so you don't have to have like a stack of cultures in a freezer that you have to take out every time you do it. We found the photographic method of taking off the culture, photograph the test as well as the real culture does, and it's good forever. And we can, of this, also make vaccines and antidotes in the appropriate machines, so that we use them. So we have cultures we have slides for all the cancers that we've made in that way. all the dental pathology from Jerry Bucco we have in slides. And we can now, those of you who use energetic testing, we can take the slides and it says fatty necrosis of the bone marrow. And if that tests against a section of the bone, that is what's going to come back when you send the biopsy in. So we've made great progress in accuracy, diagnostic accuracy with muscle testing or EAV. Works for both instruments. We have this little machine here, which is a photo amplifier. Those of you who've seen me use this, it's a great advance in energetic testing. When we put any vial, ampoule, slide on here, the material that this is made of amplifies the energetic reading of the thing we put on there and broadcasts it in the space. And we no longer have to put the slides or remedies on the patient. This thing can sit several feet away from the patient, and we can do our testing much more rapidly that way, and it has a number of advantages. Another tool we use, very important, is a dual head laser. Red laser light kills a lot of bugs like fungi, certain viruses, and certain bacteria. Infrared light attracts the immune system into the area. When we're treating teeth, we treat the tooth, an infected or sick tooth, with a red laser to drive the bugs out of the tooth. The bugs are leaving in millions within seconds of putting the red light there. They're swimming for their life out of the tooth. And then we follow that with the infrared laser. This is the strongest on the market. It's a 400 milliwatt infrared laser, which dramatically has a phototactic effect on the immune system. It means it draws into the surrounding jawbone the white cells, which then capture the bacteria that have just escaped the tooth, and we can greatly reduce the toxicity of the tooth. We've demonstrated that with the ALT testing. Many of you hopefully are using it. It's a Boyd-Haley chemical testing where you put a paper strip next to the questionable tooth, then put it in a test solution, and it shows you the concentration of toxic proteins that come out of this tooth. When we put the red laser on the tooth, let's say on a root canal tooth, within a few seconds, the reading on the ALT test goes dramatically up. That means the tooth that doesn't look so toxic before looks now a 5 out of 5, the most toxic. And then when we follow it with the infrared laser over several treatments, the tooth becomes non-toxic. And the non-toxicity stays between 4 and 8 weeks. So we can now, relatively speaking, keep a tooth relatively sterile. And many teeth that are cranky and about to die, we can save them. And then we have a method how we can broadcast into the tooth or into an acupuncture point, for example, Lyme disease, the antidote for Lyme disease, so we can specifically neutralize the toxins from certain illnesses. A chart for the newcomers, you all need a dental relationship chart. This is a chart that shows you, which tooth is related to the bladder and the kidney and the prostate and so forth. There's a couple of more tools that I like to point out to the old-timers. The main cancer that most of us guys here in the room are going to get is prostate cancer. We believe it's a mix. Chronic infections predispose. Everybody with Lyme disease has Lyme disease in the prostate. We've shown that many times with the excretions and with resonance testing and actually doing prostate extraction, prostate cancer. Some patients choose to have their prostate removed. When we do it, we can always find Lyme disease in the prostate. So it's one of the never talked about predisposing factors of prostate cancer is the herpes virus family and Lyme disease and chlamydia. So the three big ones, I'd say. We always find it in there. And then environmental toxins, the same thing. First, the changes in the environment with metals and with chemicals, the xenoestrogens, and then the infections come, and then the cancer comes. And most of us guys are going to go down with this unless we take proactive measures. And you Americans here are all obsessed with the biochemistry. You're always hoping when you swallow certain pills that that's going to prevent it. The problem with all the cancers is you swallow the pills, and the content of the pills goes to every healthy cell in the body, but not to the cancer cells. Because of the electric fields that a cancer cell sets up that prevents the antidote for the cancer to enter the area. And to circumvent that, there's different techniques. We call them drug uptake enhancement techniques. And there's a whole host of techniques, but what my German mentors have developed is for the prostate specifically 2 instruments. One is a special type of ozone that is made from room air that has an electronic filter in it, filters out the other noxious gases, and only allows a certain nitrogen compound to be present in the air that comes out, and 5% ozone, which is a biological active form of ozone. And with a rectal insufflation, we call it the German translation of the treatment. The inventor of this treatment was 30 years ago is Heiner Kastel, and we call it Kastel's fart therapy, because when you put the ozone in, it needs to come out. There's a constant flow of ozone, and sort of there's a constant stream of non-smelling gas coming out also. So it's a 10-minute treatment 3 times a week with this ozone generator. It costs about $1,500. It's doable for most people. The same ozone generator we use to sterilize the mouth. They've shown dramatic increases in health by doing a 10-minute ozone insufflation with this particular type of ozone in the oral cavity, by reducing the microorganisms in the mouth by 90%. And then by flushing, we use 2 things to restore the microflora. One was mentioned before, by opening a capsule of good American microflora and putting it in the mouth once a day and slushing it around before you go to sleep. And the other one is, there's a product, Symbioflora in Germany, which is different strains of coli bacteria, which we also put in the mouth. So it's the ozone generator to cut down the bugs in the prostate area, same with the vagina. And then the second one is a magnetic field generator, which pulses a magnetic field through the prostate, creating a dramatic amount of lymphatic drainage. And often in people my age, you can decrease the size of the prostate by 50% within 1 week of using this instrument. It's a head that looks like a skinny penis that you insert into the patient's rectum with a rubber coating on it. And treatment time is 10 minutes, 3 times a day, and within a few applications. Most prostates, the PSA that was maybe 60 or 50 before drops down to 5 or 6, and with a few more applications, the patient is clean as a bell. And then only with occasional proactive preventive care, the prostate stays healthy. So we have those kinds of instruments available also. Andriana has on her desk some photographs of how they look like. I'm always asking what you're doing, and so this is just an overview of some of the tools, some of the toys. Did I forget something? The color therapy machine, yeah. We use, I mentioned it before, a method I developed, and Lee and I are developing right now a small instrument of that sort. I call it photoinduction of host immunity. I just made a huge discovery. I think it's huge. We found that when you broadcast light in the patient's eyes, you can put a bacterial culture into the light pathway and broadcast it into the eyes of the patient, like a slide that you look into, and it will induce, within a few treatments, a dramatic antibody response in the patient to that particular bug. So if, for example, if we diagnose in a patient a stealthy form of Lyme disease, that is in the system, but the system is not responding to it, the immune system doesn't know about it, it's not reacting, you can put the Lyme disease culture in the light path in a specific instrument, broadcast it into the eyes. If within 6 weeks we find huge amount of IgG and IgM antibody in the patient against Lyme disease, and of course a positive Lyme test that was always negative before. And I think it's a dramatic discovery, maybe the biggest discovery in the century, but it's gone by silently. I didn't patent it because I want everybody to have access to it. And I don't know how far are we from the small version of the We're very close to it, yeah. We have a large size instrument that a friend of us had built in Korea that we have a photograph outside, or a little brochure outside. And that's fantastic, but it's a little bit more expensive and larger size, and allows for other treatment options as well. We do a lot of psychological work with that. Okay, I think I want to leave it there for an introduction. I want to talk about this patient that we're going to show the video of. So this was, I'll just show you my initial office note that that I found. Now this is how my notes look like. Some of you may not be very impressed with it. This is a patient since 1989. She has MS symptoms. She stated that she was free of symptoms since 1992 until a recurrence after working on a central incisor on the upper right, 1998. So she saw a dentist. I forgot what he did on the upper incisor, but he either placed a crown or it may even have been a root canal. I forgot. It was just a restoration. And just after that, the patient developed full-blown MS symptoms again, started losing motion in the left leg then. She had no interferon treatment. Now, when an MS patient, those of you who treat MS patients know, MS patients always, they're coming in a wheelchair, and in their own mind, they're still walking, and they're still fine, and it's just, oh yeah, doc, I'm in a wheelchair today, but I'm really fine, like I'm almost normal. Yeah, this was a patient who came to me in the wheelchair, and this was her history, started losing motion in the left leg. It sounds like a pretty harmless sort of thing, but she was full-blown in a wheelchair. Now, important, the second part, the patient was stuttering since sexual abuse age 2. Probably the maternal grandfather, still alive. I put always probably here. The patient always will report that with certainty, oh, yeah, it was my granddad. But I always put the probably there because nobody was there, no grown-up was there to record it. We don't have photographs, fingerprints, or any other evidence. And I always hold that it could have been another person, and we know that our memory isn't that reliable in terms of persons like that. She was very close with him until age 13. She had a medical humanectomy at age 10, so that they took the human out because she had trouble and infections and problems in the area, which is typical. And I'm always looking for some objective evidence, because so many people feel they've been sexually abused, and then when you dig down in it or so, it was something else. And so with her, we have some really true evidence that really something really happened, because they wouldn't have taken the medical surgery, the human out. And she was suspected at the time to have been raped. I looked at the medical record, and it's true. The physicians at the time suspected that this was a violent rape with restrictions in the vagina and injury and so forth. And then the rest isn't that important. I started, this was in February of 2000. So, sorry, yeah, February of 2000. And so it really took 2 years for me to come to the place where the video is going to take place. I treated her, diagnosed her with Lyme disease. I treat Lyme disease with a mix of high-dose garlic, bee venom therapy, and a few other things. From a clinical point of view, my Lyme disease patients do a lot better with that than with the antibiotic approach. In general, I do use antibiotics if the bee venom doesn't work. Bee venom contains two things. It contains a peptide called melittin. There's good research on it. It shows it's very active, very effective against Lyme disease. And foremost, it contains nerve growth factor. Nerve growth factor is the secret peptide that you need to restore a damaged nervous system. And Garth Nicholson mentioned this morning. He's injecting nerve growth factor 1, 2, and 3. Well, they're all contained in abundance in bee venom for almost nothing. They're hugely costly if you buy them in the industry. And so I use the cheap version. Bee venom has other peptides in it that all have a synergistic healing effect. So when we try to treat Lyme disease, I'm not trying to just kill the bugs, but I'm also trying to make the nervous system grow back and heal. And bee venom therapy has a couple of glitches in it. I'm not going to talk about it. But once we work those out, it's probably the most fantastic new therapy because it not only stimulates immunity towards all infections, including viral, fungal, the bacterial, but it has multiple agents in it that have antibacterial, antifungal, antiviral activity direct. So it stimulates both the host and it kills the bugs. And it's just dose dependent, and there's a certain rhythm to it. I have outside on our table a treatment protocol for the use of bee venom. We have another protocol that I think we forgot, that's specific for Lyme disease. It's on my website. The website is neuraltherapy.com. Okay, so this is Judy. Judy was in a wheelchair when she came. I got her with the bee venom therapy to go from a wheelchair to a cane. And then really didn't make any progress. And the problem with her was that my best friends, Florida and Erie, Pennsylvania, had worked with her in terms of dentistry. And now some of you have heard there is this new technique of doing root canals that are no more toxic. Yeah, by using biocalyx or other materials, using different lasers of sterilizing the tooth and all that. And after this case, I'm totally convinced that it's a bunch of hogwash, and the only results that are seen is that maybe the muscle testing disappears with a poor muscle tester, or maybe with a poor EAV practitioner the readings improve, but the patients never improved with those techniques. Yeah, the patient got forgotten. When you look at just the testing, a lot of things look good, but when you look at the patient, a lot of things don't look so good anymore. And so we're completely with neurological illnesses. After this case, you may agree with me, it's not the only case, I've got probably 50 of them. Yeah. In a neurological patient, it's not acceptable for the patient to have any metals in the mouth, and it's not acceptable for the patient to have any root canals in the mouth, or any dead teeth. This is a neurologically ill patient. And one of the things the point I like to stress here is, it's completely different when you have a young, healthy man coming in your office with a couple of root canals, versus you have a patient in a wheelchair coming in with the same number of root canals. In one, a lot of things are acceptable that are no longer acceptable in the other. And it's been very difficult even in the community of the alternative dentists to get that point across. Just use a little common sense. You know, if a patient is in a wheelchair, in God's eyes, you're practicing malpractice if you do not take out the metals and the root canals, because you're depriving the patient of a chance of a full or close to full recovery with that. And I speak to you as an MD. I speak to you from an MD point of view, who's seen these patients over and over and over. It is not acceptable in a chronically seriously ill patient to accept any of these imperfections in the mouth. Patients do a lot better with extractions and good partial dentures or full dentures that are done in the right way. And I want to show you this case now. So I have not seen the video myself, and here's the thing. Dino has tried to streamline a portion of it. It's 35 minutes, something like that. The first portion is 35 minutes. And then, to be nice to you guys, we decided that we show the rest of the video. It's about an hour tonight at 8:30 here, for those of you who are willing. Okay. Okay. Okay, so we do that at 8:30 sharp tonight here, and it will show the further down treatment where DJ and Dino work on the emotional issues, and this patient reveals so much about that, so much truth about that I think some of you may want to just hear that.
You said that it started with restoration of the front tooth. Obviously, I think this was the composite bonded to the tooth, was it?
It was probably just a composite filling, yeah.
May I say something that there's so much testing of the newer bonding agents that have come out, the dentin bonding agents, and just about all of them really do not test out well.
Yeah.
Old, like Colgate whatnot, they don't make them anymore.
Yeah.
But the simpler bonding agents seem to be less toxic. The newer ones seem to be very highly toxic. And I just put that out for you.
Yeah. I'm not, in my part of the talk, I'm not going to go into like, what do we do for restorative dentistry? For us, the important thing is you need to have a testing technique, either biochemical or energetic testing technique, to be able to predict what material is going to be tolerated. And some of them are simply bad based on toxicological points of view. Some are simply bad based on the allergenic effects they have. And it narrows it down to a small group of filling materials, crown materials, binders, fillers, etching agents, that are, for this particular patient, not toxic. And that's a whole other issue. And you know, I don't believe anybody can do good dentistry without having either a clean way of muscle testing or a clean way of doing EAV testing. I do not know how to do that. And I've seen, like you have, we see cancer patients, we see severely neurologically ill patients. They've seen the best dentist who's done the best mechanical dentistry you can do, but the materials are killing the patient. And so, and with our methods, I feel we've 80–90% of the time we do the restorations, or we have the dentist do the restoration with those materials that are tolerated, even in very severe circumstances. And if somebody is terminally ill, we take the fillings out, we leave everything open until the cancer is healed to a degree where the patient is no longer terminally ill. Then we may put in just a cement or just some mild material that is non-allergenic for another few months until we progress with our other cancer healing, until the patient is stable for a while. And then we may put in the first permanent dentistry. So there is a method to this. We need to know. Remember, like this, maybe I'll say this before the video starts, there's two axioms. An axiom is a statement of truth that cannot be proven or disproven. There's the Arana axiom, which is, how do you know if a patient's medical problems are linked to something in the mouth? And the Arana axiom is, the answer to that is, you look in the mouth of the patient. If you see any dentistry in there, you know there's a problem. And then there's the Klinghardt axiom, which I can tell you afterwards what that is. Okay. Yes. Oh yeah. No. She has a hardcore medical school diagnosis from the what's the clinic in Pennsylvania? What's the big? It's not Mayo Clinic there. The Cleveland Clinic. The Cleveland Clinic has confirmed the diagnosis with all conventional method scans. She had severe demyelination in the brain, all that. We do actually, I have that here.
There was a bit of controversy on that. There were some people that said that she didn't have.
No. Understand that any MS patient, and this is something about conduct with the patient, any MS patients will seek out a number of conventional practitioners until somebody says, I'm not sure if that's really MS. And that's what they hang on. And they will come to you and then say, well, I have these neurological symptoms, but it's not really MS, because that one guy out there in a little village in the country said, I don't have MS. Yeah, but she has the MRI evidence, the CT scan evidence, and she has a CSF exam that shows a positive. Yeah, so let's just kind of learn that also about the patients. An MS patient will be in denial until they drop over dead. They will not say, I have MS. They will always kind of say, well, I got this illness that looks like MS, but it's not really MS. I know inside it's not MS. And so from a conventional point of view, it is full-blown MS. Okay, let's do the video. And I don't know how good it's going to be. Quality is going to be a layman's quality. Hey, Dino, do you want to... Dino? Dino is the guy on the video. He did all the hard work. He's going to comment on it.
Can you just put her on pause there for a second?
The upper left, bicuspid, it actually released your ankle. Yes. And not only did your pain go away, but your balance also improved.
Can you put a pause on that?
And then,
Where's the pause button?
You were walked out your cane, and you were standing. So we did this.
Do you have a pause button? No. Forget it. It's okay. Okay. So you're gonna have to use the mic up there because we're using this.
No appropriate
Oh, that's can't stop it. I had done diagnostic anesthesia like we do in neurotherapy and freezing the teeth. The teeth that tested for this young lady were the upper root canal. She has 5 of them, and and a dead tooth besides the root canals. And
What we're going to do now is we're going to retrieve those teeth
yeah, please.
and test you and see what.
This is after your
Okay.
diagnostic one?
Let me just backtrack a little bit so that everybody is on the same page here. There are two obvious problems with this young lady from my perspective is that she had a structural problem with her bite, and that will become very apparent to you as the video goes on. And also, I was wondering how much of an interference her root canal represented, not from an infectious point of view, but from an interference point of view. The first thing I did for her, because she sort of parachuted into my practice on an emergency kind of basis, and this fellow here was anxious for me to put some kind of a splint because her bite problem was very obvious, as you'll see. Her deficiency, especially when she talked and swallowed and whatever. So when I gave her a diagnostic appliance to kind of idealize her bite and make her swallowing more ideal, so she didn't have to waste as much energy every time she swallowed. You do that 2,500 times a day in order to seal and also support your head. It made her pain worse because her main symptom was her left-sided leg pain that, according to her, was a 10 out of 10. And when she bit on when she closed on the appliance, she liked what it did in terms of her balance, but it exacerbated her pain 10 times worse. And what triggered it was a tooth on the upper right, which is another clue that obviously there's something else going on there. So the next obvious thing to do is to neutralize those teeth, and we do that routinely in neurotherapy by injecting basically procaine. In this case, I did more than that. She tested for heavy metals, for solvents, for some of the homeopathic remedies, and I did a cocktail that I would penetrate it into her bone through a stabident. It's a way dentists use to freeze teeth. So you make a little hole into the bone, and you inject your goodies into the area of the roots. And that has a way of neutralizing. Of course, most of you are very familiar with this because I'm sure you do that every day. But it's a way of neutralizing the tooth and taking it out of the circuit as if you're replacing a blown fuse. So if there's any connection between the tooth, say, and the symptoms, in this case, the symptom was very overt. I mean, I'm sure you saw it, her walking. So if there's any change, first of all, in the pain and in her balance, then we know that there's a electrical disturbance or a focus in effect here. So I did this. This is a Sunday. I did this on Friday for the first time. And she had 18 hours of relief, that she was pain-free and she could walk normally. And also she wore her appliance. Okay, now it's kind of debatable what the appliance is doing at first, but it will become clear as towards the end, and she'll make it clear to us as to how much of a factor her bite is, because there's two initial factors here: structural and electrical. So now. She's come back now, and and if you want to just rewind that just for a second.
And the symptoms are back.
The symptoms are back, okay? She had 18 hours of relief, and she's very, very depressed because when you have a pain, she's had the pain for 5 years, and she's been on painkillers.
No.
Okay, I think we get the. So now I'm going to re-inject those teeth just to reprove what we saw.
Now is we're going to retrieve those teeth, test you, and see what.
Yeah.
Okay.
So
That's the other thing that helped.
Yeah.
For while the whole system got reconnected, that also got
With that procedure.
neutralized.
Yes.
You had it since age 2.
Okay.
Yeah.
So
Yeah, I spoke to.
Okay,
I
watch how
ate
she
with
talks,
her
and everyone what
her
she's
daughter
saying.
And her granddaughter. And,
Just look at her jaw. She almost looks like she's got palsy on the left side, and her jaw kind of.
To my father
uh-huh.
that night, and I did fine. And I spoke on the phone with him today, and I was stuttering every other word.
Uh-huh.
So,
Today.
yeah.
But not on Friday.
Okay, this is when she goes through her teeth, and you can see that looks like a very normal kind of bite. But look what happens when she starts talking. That you'll see that the jaw goes to in a totally different position.
And close. Okay. So you get a bit of
And
a crossbite here.
she's programming off. You can see there's a crossbite on that tooth there. In other words, the lower tooth is not in good relationship with the upper tooth. And she's always trying to avoid that tooth. And she has...
And then when you talk, you kind of...
Yeah.
Can you turn the volume
Upper
up?
teeth
John
there.
did this one.
Yes.
Look, when she talks now, her jaw shifts to the right.
Say Boston for me. Boston. Anything.
It's
I just want to see this thing here. Say Boston. Boston.
Okay.
Boston,
Okay, Mississippi.
Mississippi.
See how her jaw postures now when she talks versus where she goes through her teeth.
Take a peek
Totally different.
as to where you go.
Look how much she opens up. That's a.
Then you go over here, of course.
She has no support.
Now also void here.
Lack of vertical dimension.
I'm gonna move over to the right, I think. And, then you
And
come
absolutely
to
no
the
guidance on the
left.
left
There's
side.
space
Her
there.
cuspids don't line up there.
Many things with your jaw. I think you're programming in front of your teeth. So, can you say very fine?
Very fine,
55.
55,
Boston.
Boston,
Okay. Boston.
Boston.
Smile. Let's see.
So you see how the
right.
space on between the cusps on the left opens up. That's very important. That gives you a hint that there's a problem there. So this is a diagnostic appliance that over-opens her on purpose to kind of give her support, create a cage for her tongue to swallow in a more normal sense, and relieve her tongue of extra duties. That the tongue has to
That is much
sort of
on this side here.
close up the spaces that she's missing a whole bunch of teeth on the lower left.
Mississippi.
Mississippi,
Boston.
Boston.
Okay, you also said that while you were wearing this thing, your tongue kind of got shrunk a little bit or started behaving itself?
Mhm.
No?
Yes.
Okay. That's good. Good. Stop this. So, Judy, so the pain there is very noticeable on the left side.
So we're just in the process now of refreezing those teeth.
It's exacerbated when you bite that tooth there as well?
Yes.
So that part is back again?
Yes.
So there's 3 teeth on the upper right and 2 on the upper left that tested.
We've neutralized one of your teeth, the
And the
sixth.
second time was just a regular thing.
Okay.
And I'll-
So the pain.
Is down 80%,
Okay.
ankle and proprioception now still on,
Okay.
big time.
Any improvement from before?
Completely gone.
You were saying?
The
Now,
pain, the pain in the leg is
Completely gone.
Now I've done the other side now too. I've
Your
done
back.
more injections.
Speech is better.
yeah.
What was that? Back to Friday.
Yeah. Is that incredible?
Completely.
You can walk a mile.
So we're capable, Judy.
My leg is tired. It's very, very tired from
Yeah.
being in spasm. So I feel the tiredness.
It's different. It's a different feeling.
Oh, yes, totally. Yeah. It's not anything bad. It's just tired from being in spasm. I feel fine.
Yeah.
Leg-wise, balance-wise. I can even move with my eyes closed. However,
And
I've
you
been
don't-
diving in that in about 12 years.
Yeah. And you don't need your cane.
Not
Somebody was in a wheelchair 2 days before.
Not at all.
Yeah, you'll see. That's
So this is, so we've neutralized just your upper teeth, eh?
Yep.
And you're wearing the appliance?
Uh-huh.
Okay. So let's take the appliance out. So this is, you know, so the pain is gone, right?
Mm-hmm.
So the pain left after we injected 80% of the first tooth, the big one, right, on the upper right?
Correct.
And we had a hard time freezing that area, didn't we? Because that area is very disturbed.
It, thumbs, toes are fine.
Okay.
Lifting my leg is good.
You can lift your leg.
Yeah.
When was the last time you were able to do that? Like that?
1997.
Really?
Mm-hmm.
Because, you know, a minute ago, you can even, you know, you can go on your toes or
No.
walk. Okay. So put your pliants in.
Let's see what this guy can do.
Yeah. Okay, so. Oh, this is exciting.
It's fun. I mean,
Yeah. So does that give you a little more stability, obviously?
Yeah.
When you neutralize your teeth, you have the ability to kind of not only think about it, you know, but maintain your balance.
correct.
Whereas before, there was no connection between your brain and there was sort of like a disconnection between
There
your
was
legs
no
and
proprioception.
no proprioception, no
No.
feedback.
No.
Okay.
Like
So-
I could have never stood like this. I'm standing with my left leg planted on the outside. I'm not even standing on my entire left leg,
Yes.
and my right leg is pivoted to the back, so my hips at a 40-degree angle.
Yeah.
I've always had to stand with my hips parallel,
Right.
but now I can stand at a 40-degree angle. You know the ones that the top fashion models, you know how they stand and then they pivot.
Next thing we know, we'll see you on the runway, right?
I've got to lose maybe 100 pounds.
Okay. So, and let's see. So we've done your sinuses too. So what did that do?
Oh, cleared my
Open
head.
your head.
My head feels like it's not a huge lump.
Yeah.
Disturbance that day was their sinuses. So we did
And
a
then where's the
both
pain?
sinus injection
Went with
points
the first tooth we
and
took
a
off.
sinus
I
flush.
mean, no,
And that totally
Okay.
restored her.
can handle it.
Always you forget though, is it instant?
Oh, yeah.
Once it's gone,
Yeah.
you know, it's
Because when the
history.
when pain comes back, it's just so,
It's
and when I've had it for 4 years of my life,
yeah.
you know.
Well, at least we hit the nail on the head, right? So that's a good thing, and you responded. That's the other good thing. Because we could have done all these things, nothing would have happened. You know, I mean, didn't have to,
Right.
you know, and so the.
Trust me, if it wouldn't have fixed it, I would
Well,
have run your neck down.
No, I mean, obviously, yeah. But anyways. Well, you know, there's no guarantees in this. I hope you realize this.
I know.
It's Monday. We started yesterday.
Mhm.
That's today's what, the 27th?
28.
28th, okay. And yesterday, the magic of the
Next
freezing
day.
of your teeth has
And the
worn
magic
off,
is
and-
worn off.
And then
The
we
pain
did it
is
again,
back.
and the same thing happened.
Mhm.
Pain went away
Mhm.
on your left leg,
Mhm.
and you're able to maneuver a little better. So let's just see today what's. You said that the pain came back this morning.
Yes.
Okay, so go ahead and have a walk.
The left leg is very, very weak. A lot of pain in the hip flexor, through the quad,
Yeah.
into the knee joints. The ankle's very stiff. I have to think plant,
Uh-huh.
so the proprioception is
Not there?
not there at all.
Okay.
It's not a very good day. It's not as bad as it was
Yesterday.
yesterday prior to the freezing.
Right. But it's getting there.
Yeah, it's definitely getting
Okay,
there.
take another walk a little, just turn around. So there's no way you can stand.
I can try.
Well, no, but what happens without your canes if you weren't to use your cane?
The pain is tenfold.
Yeah. You're struggling.
And I have to pigeon toe to balance
Uh-huh.
without the cane.
Okay.
And planting my foot completely is very painful.
Uh-huh. So you're very tentative too. And
Very,
you really have to think
very much so.
about your balance. It kind of preoccupies your brain, doesn't it?
Yes.
Like my next step and where's the nearest wall to lean onto?
Exactly.
Okay. Okay, you're kind of leaning over to the left. Your whole body leans over to the left. Okay. Don't worry. Okay.
Not as bad, but yes, more than.
Okay.
Yeah.
This is without the appliance, right?
without the appliance, my left leg feels as though it's not connected.
No, completely.
It's like I have to drag it. Planting is very, very difficult.
Uh-huh.
I can't. Let's see if I can lift my leg. No, my
Can't lift the leg.
quads tightened, hamstrings tightened, and I can't.
Uh-huh.
No, can't.
So what happens when you put the appliance in? Put the appliance in.
Just want to tighten. It's lifted a little bit. It's about an inch off.
Okay, so there's something good happens.
Yeah. Yeah.
Okay.
And I can
And then you
plant.
can move.
Yeah, I can plant much easier with
Easier.
the plants.
Okay. So today we're going to take your teeth,
Yep.
incavitate the bone,
Yep.
and we're going to throw away that cane.
I'll never
Right?
use a cane ever again. You hear that? Never.
Okay.
I think it was, no, it had been end of 2000.
Fast forward that a bit.
About a year ago.
About a year and
Yeah, keep going. I just wanted to show you my view there, that's all.
Where is that?
The top secret, I'm sorry, I can't tell you. No sign on the door, just, you know, for security purposes.
Can I say something just while you're reminding?
Yes.
Because I work as a medical intuitive and I'm Cherokee, so I get being able to see everything that went on with that.
Yes.
So she had violent sexual abuse. She had trauma to the head. She had
To the
oral sex, forced oral sex, and you know, there's a lot of things that you're releasing with the neurotherapy, and you know, I work with the doctors and the dentists to support all of what you're doing. And as dentists and doctors here, may not be able to see that. So
Yes.
even though she's not being able to tell you the whole thing, I can feel everything that's going on in her body, and it's quite profound.
Thank
when
you.
you put the
Appliance.
appliance in her mouth, she goes into her childhood as supported.
Yes.
She immediately goes there. She begins to talk from a place before the abuse happened. So it's pretty exciting to see. It's
Thank
also
you.
not easy to sit here.
I get that help from my wife because she has similar gifts as you do, and it's nice to kind of get some feedback like that.
Well, I thought it was an important place to put it instead of just letting the whole thing go.
Thank you. Okay, now I'm doing the surgery, and this is a classic connection that we sometimes see. I mean, I haven't seen this too often, but I'm sure some of you guys that do the surgery have probably seen something like this again or before. And as I'm cavitating or working on the area, I'm working on the upper right first. Her leg is like she's undergoing like an epileptic seizure, and it gets really violent at times.
These are involuntary movements of the leg. They're typical for demyelinating disorders.
Can you show over there?
Yeah, just want to show that
And this is before even extracting the teeth. You can see the extent of the cavitations around the teeth. They're just empty spaces. And I had a hard time doing the stabby then because the bone was so petrified. And then you can see how shiny the sockets are. The bone is like glass. The socket walls were like glass. They were like a super necrotic, super condensed. And I don't know if it was the laser that did that or just she's had this root canals since she was a teenager. So they could have been obviously a factor in that as well. But I had a hard time removing.
The root canals were all redone though with a new non-toxic way. Yeah, there were all root canals were redone to make sure that they're not
But she had a 4-month window there that things did improve. And here I'm just muscle testing to see if we're finished. And it's very specific. You have to kind of go around and poke at there's still some. And you can see there now that just about we've got everything right up to the sinuses. There's the socket walls are gone, and I think the leg has stopped shaking at this stage. We use both direct and indirect testing. Now with Judy, I tested it, or she was in on the weekend, so I didn't have my assistant. So I knew when she was connected and disconnected just by the strength of her arm, and that's something that we all familiar with when you do this kind of testing. Yes. So this is what we're doing is the ART, which stands for autonomic response testing. And I'm testing now materials. And I'm making sure that the compatibility, and also just because the arm test's strong, I want to make sure that's not a test for block regulation.
That's the big challenge you have.
I'm sorry? It's collagen fibers. You can get plugs of it, you can get pieces of it. And she tested for that. On this side, not on the other side. Yeah, collar plug.
In my soul, I knew it.
And this is on my day off, so I'm not in my surgical outfit best. I like to do that. Could be. It is my house, actually. I work out of my house. So we've done the right side now, and she's still in a bit of a daze because the anesthetic.
Right now, it's kind of hard to tell.
But she'll become more animated. You'll see.
Hey, walking real balanced.
I feel very, very balanced. I feel the hip flexors are totally relaxed.
Now, is that beyond
Beyond
what we injected?
Beyond,
the testing.
Yeah.
Yeah.
My hip flexors very relaxed, my quads relaxed, my hamstrings relaxed.
Yeah.
It's amazing. I haven't felt this way in years and years and years and years and years. So it's a new feeling. It's totally new. It's a positive. It's a good feeling.
Okay. So we've gone beyond just when we just tested that, because I was hoping that would be the case.
Beyond when it was just frozen.
Come.
And that was when you were growing up and going to the
Okay,
dentist.
that's a very important point there. You notice that her arm went weak on that particular item. That's
What are you
Chlorolife.
testing her for now?
But on testing, if it's a yin state, she tested for a yin state. So, which means that that particular item is extremely good
I take a
for what we're doing for the sockets.
It has chlorella.
So now we're doing the other side, and the same thing is happening. That's ozonated, heavily ozonated water that we're irrigating with.
And it's happening in not just your foot, her knee and her thigh is beginning to move a lot. Where'd you want me to film? What you're doing?
The leg is on shaking.
Yeah, her leg has stopped.
barrier,
Yeah.
the
Yeah.
so,
So
socket, you know?
it was
And
just
then the leg quit.
one portion of the socket that was still resistant, and as soon as that was cleared, the foot stopped, and then that usually that would signify the end of the surgery, and we're just verifying that now. So her arm grows weak now. For those of you that are not that haven't taken ART courses lately, could mistake it for something has gone wrong. But when we test it to see if she's in a yin state, you can see that her arm grows very strong. So in fact,
Is it a yin state?
Dietrich can comment on that because he's my teacher. But what would you say that would be? A good outcome. This is what you're hoping for every treatment that you do, is that you get the person
And
in a
what are
yin
you
state.
using now?
This is about at least half a dozen concoctions in here. The cocktail consisting of trocaine. And as I kind of test it ahead of time, I usually do this when the teeth are in place.
So we use ART to test for
DMTS, for MSM, arthrocheital A, notocheial, tromeo, lymphomyosode, echinacea, and I think that's about it. But
and she didn't test for antibiotics.
Yeah, her whole body is completely calm.
I'm doing that now. Scraping here, scraping here.
You're scraping,
I'm scraping everywhere.
Quick word
and her
about
body
the
is
surgeries.
completely calm.
Those of you who don't do these surgeries,
So,
this
I mean,
dentist here and osteopath is being the main.
well, they do different things. The red chases away bugs, and the infrared
work. He's sort of now worldwide one of the 2 or 3 people that is known for doing the best and cleanest surgeries in this area, and he's been teaching since a few years, dentists. So if you want to learn how to do this, if you're not doing it yet, talk to Chris.
I always send my most difficult patients to Chris or anybody that can afford them. The only trouble is Canadians are very poor people. You know, our dollar isn't worth that much. So, Chris, I'm sorry. I tried my best to send you more patients, but you know, things will change.
How's it feel? Yeah? Put your arms above your head and see how your legs go. Now take a few steps. How's it feel? Perfect. Balance? Can you close your eyes? Okay. Can you get up on your tiptoes? A little off balance, but not. You did great.
She hasn't done that in 7 years.
There's no appliance. How's the pain in your legs?
Gone,
Gone.
100%, no pain.
Wow.
So how different is this than just the previous part, Judy?
More stable, more like my legs are connected. More, it's not like it's separating my legs from the rest of my body
So it's a
when it's
deeper
broken.
connection.
Yes.
Now this is with the appliance.
Yes.
You're on your tiptoes.
Yeah.
Absolute balance.
With my eyes closed.
Yeah. And
I feel
tap.
like I have complete
Control.
Yeah. The
So you
proprioception.
don't think you don't have to think about the bottom.
No, proprioception is there without, you know,
Okay.
And
So
tap.
it's perfect.
you go home and you pray. So we'll pray, okay?
I'll be journaling and praying and
Okay.
meditating and
I'll
trancing.
give you the laser. To kind of laser that a couple times. Okay. So you're.
So this is
you wore it. We
4 or
made
5
your
days
heart
later.
spin on Friday.
I gave her a heart splint on Friday, which is 3 days after the surgery.
Sunday, which was last night,
Yeah.
I decided to do a few tests. So I took out my plate.
Yes.
I went outside to walk on the uneven surfaces and on the steps, up and down steps, and I don't have the balance that I have with the plate in.
Can you put a stop on it for a
I mean, you
second?
can see it.
Yeah.
You can
So
see it.
Okay, put a stop there. So the fact that she has a bite deficiency is, to me, is obvious, and it's one of the big factors. Now, it hasn't been obvious dramatically as to what does what, because I think the electrical component by far was the most pressing or the more primary component as far as prioritizing the different components. Did you follow me so far? So now she's had a chance to, we've done the surgery, we've neutralized the the electrical disturbance by cleaning out her root canals in the bone, and the other dead tooth that was also very important. And she had a few crises that we don't have time to go into right now, that we were able to help her through testing and find out where she was stuck and doing the neurotherapy and helping her along the way. It had to do with her kidneys and her sinuses. And something happened when we were doing the sinuses that we'll discuss if you guys come back later on tonight, that has to do with the emotional component. But she's had a chance now to digest the being reconnected and not having the electrical disturbance to put up with. Now she can tell us better how much of a component the structure, her bite is. So this is what this is about. So go ahead and play it, and you'll see.
Okay. Well, first let me see because I put on, I can dance, I can do anything I want to do.
Yeah, you can
Okay?
do, yeah,
I take the plate out
okay. Then what happens? Take the plate out.
and, okay,
Yeah.
now I'm gonna get
Yeah.
up on my tiptoes.
Yeah, yeah. Oh, right away, huh?
Yep, right away. I do not have it. I do not have it. I don't
So
walk
you walk
it
as you
smoothly.
walk.
I don't walk it as well. See, look
Yeah, your weight is shifted.
Yep, totally.
You collapse.
Completely and totally.
But much
You're
better
gonna lean over on the left
than
side.
before, of course, without her splint, right?
Yeah,
Now,
So let's
let's
put
put
the
it
plate
back
back.
in. This is amazing.
yeah.
Plate in, plate in, see?
Yeah.
Oh, my button!
No. Oh, I was so worried. I thought that was a plate.
No, it's the button. It's the button.
Okay.
And now she's bent over.
Right.
Oh, I hope you didn't get that.
I did.
That's a wide shot. See,
great.
and I can
So that-
tiptoe and
yeah.
everything. I can close my eyes. I can stay up there.
Yeah.
Everything.
But take the plate out. Okay, try that again.
Take my plate out and
She can't fly.
it's almost, yeah.
Yeah.
So this is the day before. No, not the day before, but the day before the surgery, or the day of the surgery, rather,
And the hip flexor through
like 5 days before.
Yeah.
into the knee joint. The ankle's very stiff. I have a thick plant,
Uh-huh.
so the proprioception is
Not there.
not there at all.
Okay.
Just to show you where she came from, just kind of a reminder.
It's not a very good day. It's not as bad.
So this is the splint that I had to make myself because she came in on an emergency
Now
basis,
you learn, it hurts.
and it's giving her a wonderful cage for her tongue when she swallows, and I think her vertical dimension is pretty close to the ideal.
Okay, close. Okay.
And she can go into excursions, which in our way of thinking is very important.
Slide to the left. Good. Slide to the right. Okay, good. Slide forward. Okay. Let's see, open.
Now you can see now
Take this out.
what her tongue had to do before in order for her to swallow. Oh, and then if you remember what she looked like when she bit before on her teeth, now it's obvious what her problem is. You see how the jaw lines up now? Because she had time to deprogram from her old bite.
No guidance.
But you see that the deficiency on the left side. I know the dentists here that do these things it's pretty obvious. And then, of course, lack of vertical dimension and support on the right side, and of course the left as well. And then her tongue had to act like a bellows to cover that base every time she swallows. So it makes the swallowing a lot more complicated when you have a situation like that. And you waste an awful lot of brain power in the swallowing function, which is a vital function. And you do that 2,500 times a day. So this appliance takes her closer to the ideal, makes the swallowing a no-brainer, as Dietrich would say. And then, of course, it's helped her speech, believe it or not, and she does way less stuttering. And this is just a reminder, what did she look like before? She doesn't show us any of the discrepancies, like the appliance has helped establish the discrepancy between the ideal kind of bite, where she needs to be, and because the pathology is hidden here. And because she's onto her teeth, and that's all she can do. But the appliances help to unwind and reestablish their jaw position, which is closer to the ideal.
Here on the side. Or very little. And when you talk, you kind of.
Yeah.
But you can see a hint of where she wants to go when she talks. Her jaw shifts. I don't know if it's subtle, but to me it's not that subtle. Jaw definitely shifts to the right and it opens up on the left. And I don't know if you can see that or not, but that's...
I just want to see this thing here. Okay, let's take this off. Say
Boston.
Boston.
And you can see when she talks, now the space opens up on the left.
Okay, Boston.
But when she has to swallow, she has to go all the way to her teeth. So it's like landing on flat tires every time she swallows.
There.
And of course,
over here, of course.
and it's exactly where she ended up with almost.
Right here. You kind of move over to the right, I think.
Mm-hmm.
And then your tongue splits to the left because the spaces are there. And you do some funny things with your jaw. I think you're programming in front of your teeth. So, can you say very fine?
Very fine.
55.
55.
Boston.
Boston.
Okay. Boston.
Boston.
Smile. Let's see. Okay.
Just
All right. Put your appliance in. That's good.
now we're trying stairs.
Now I take out the appliance.
Then take the appliance and you go up the stairs. This is without the appliance?
Yep. Here's the appliance right here.
Okay.
And then watch
Okay.
how my legs open out.
Careful here. Careful.
See how I don't plant
Yeah.
on the left
Yeah.
or on the right.
All right. So.
And if I would hop, I'd fall.
Yeah. Well, put your appliance back in. Easy.
Now this is fun. I used to do this.
Wow.
No hands.
That's
No
good.
hands, Mom.
Good for you. Great. Let's just see here now. So obviously you've lost the benefit.
So
you
again,
had with your balance.
a reminder where she came from.
Big time strain. Don't have any feeling in my foot whatsoever.
I think we can stop that now.
No proprioception. Pain on
Okay.
the skeleton.
So the important thing to know that I don't want to understress or I want to stress enough the importance of the bite component, because had that not been covered, I mean, I can ask Judy not to wear appliance for 2 weeks, and she will present as a totally different person, because then she would have to put up with the deficiency of her bite involved with the swallowing mechanism, never mind eating, and the posturing and the evasive action she would have to take to put up with that. So she can tolerate that walking better with taking the appliance out and just doing a few steps, and you can see the difference immediately. But if you were to keep the appliance out for any length of time, then you can see that it would set her back a great deal, and she could certainly end up going around in the cane again. I could see that happening because the discrepancy of her bite was that big. It's just that she couldn't show it to us at the beginning. In her particular case, and everybody's different, because of the electrical disturbance. And we were lucky enough in a sense that this person is complex case, but simple at the same time, if you know what I'm saying, because her problem is pretty gross, so it's not subtle, because it's the subtle cases that you get that you can't figure out, because it looks so close to normal. But in her case, just through phonetics and loss of teeth and stuff, I mean, I knew there was obviously a discrepancy there. And the other thing was that the emotional component came up during the treatment. And we were able to kind of neutralize it and release it, and that's kind of helped her secure her healing. And she's lucky enough to have covered all their bases through what Dietrich did to detox her, and she saw other people that helped her, counseling and what have you. And because every time she had surgery before in her mouth, she had the dry sockets, she was on antibiotic coverage, she had the whole 9 yards, and it would set her back into a wheelchair every time. And that happened 3 times for her. Every time she had any kind of dental intervention, whether it's a root canal or an extraction. And this time, I think thanks to the hard work that she had done, and she was obviously ready, it's like I'm the pitcher and she's at bat. And when that happens, the timing is right, and you can get it to hit a home run if you give her the right pitch. And basically, that's all we did.
Thanks, Dino.
Okay.
Give him a round of applause.
Right. Thanks.
Yeah, everything. All the conventional attempts were done years before we saw her. Let me maybe recapture this case a little bit. So here's a case who was diagnosed in the late 80s with MS, then went into remission. Now, remission for her was that she was walking on a cane, not in a wheelchair. That was a remission she had for a few years, with a severe stutter and severe compromise in her life. And in that years, several treatments were tried in a medical school environment. And then she started seeing me 2 years ago. We detoxed her. We dealt with a lot of emotional stuff. And then we taught her bee venom therapy, so she's injecting herself twice a week with bee venom as a treatment for the Lyme disease, which I diagnosed as an underlying component of her illness. And she was, when I was done with her, she was like maybe 60–70% improved from where she was before, but still most of the time wheelchair bound, but happier, and only had pain in the left leg versus complete body pain at a rate on a scale from 0 to 10. It was a 20 day and night. We got it down to just one leg hurting. And that was when I sent her to Dino, and Dino did a combination. The diagnostic procedure was a diagnostic splint for a structural component, and then the intraosseous neural therapy by drilling a little hole in the jawbone next to the affected teeth that we were suspecting, putting a mix of local anesthetic and a few other things next to it, and then have an instant improvement, which predicted that the surgery would be a good outcome. And then the surgery improved her beyond of what the injection did. The injection improved her 80%. And then this, to tell the truth, like when she came back from Dino, I knew she had this improvement because he talked to me on the phone every day. That morning I came up to my office. My office sort of has the entrance door sort of up on a ramp, sort of like a car ramp. And I came walking up this ramp I couldn't find a parking spot in front of my office, and I had to walk a little bit. Walked up this ramp, and there's this attractive woman kind of running down the slope towards me, jumping in my arms. I didn't know who she was. I thought, my God, I must have done something in the past with somebody, where I must have been really drunk or something. And she had made a point out of it that she'd gone the night before to the hairdresser, and she had makeup on, and she looked gorgeous. And I didn't recognize her. And then when I recognized her, I just broke out in tears. I was just, I couldn't hold it. I was right in front of my office, with the patients walking in. I was just kind of sobbing because I couldn't believe that, I mean, we've seen this from time to time, but this is maybe the first time that we documented healing like this, and it happened in such a short time from a clinically severe position. And we're not talking about the emotion tonight. We show the video portion that goes more into the emotional aspect, but also this woman was severely depressed. Marriage was falling apart. She was suicidal over Christmas, again, because she just had given up all hope. And going from that to being like an incredible, intelligent, bright, beautiful, joyful, sexy woman in just a few days, so I think it's incredible documentation of what biological dentistry can do with different methods.
The other thing that she commented afterwards, and you see that in the rest of the tape, was that she said, I was willing to accept the pain because it was there every day. It was part of my everyday life. But the worst symptom that she had was her brain fog.
The brain fog, yeah.
Short-term memory loss. She had absolutely no brain.
Mm-hmm.
She had to read back. She said she could read 7 pages, and you had to go back and read it again. And she could read a book that had more than 5 characters.
Mm-hmm.
And the second day after the surgery, she said her brain just opened right up. She read 5 books in 4 days, and she says, I can tell you the titles, the authors, the characters. And to her, that was the biggest gift. She didn't care as much about. She wasn't excited about her leg and her losing her cane? Because we'll see tonight that was one of her insights, that she got depressed after the surgery because she felt so good, and she missed her cane.
Yeah, we get into that tonight. But 2 years ago when she came, she looked like a boring, sort of middle-class housewife, sort of depressed, and just sort of as unattractive as it gets from a male point of view, but also like as unexciting from a human point of view as it can get. And she turned from that to a completely joyful, angelic, funny, humorous, intelligent being, sort of virtually overnight. And to see that transition, I think, we're going to make this videotape available for those of you who need it as a teaching tool. If anyone ever wants to demonstrate to patients what these different things can do, and I think also for various court proceedings it may be helpful to convince the jury one way or the other. So we want to make that available for various uses. Judy, the patient, is completely willing to make her case available. By the way, this was a few months ago. She's still doing fine. She is not having the usual relapse that we often see with these, and I believe it's the ongoing treatment for Lyme disease.
She had windows before, when she had the root canals with the laser. She had a few months of that she could go without her cane, and the pain was down, but she never got her brain back. The brain was always there, the fog. And that's the big difference this time, she said.
It was a couple of months ago. But anyway, she's also on the Shoemaker program that results from the neurotoxin test. It's a program that we have now to withdraw neurotoxins from the body, which is absolutely fantastic. I don't have time I was going to lecture on that program. We won't have time to do that today, but we do a combination now. We treat Lyme disease in two ways. One is a program to withdraw the neurotoxins, which we do with a drug called Questron and another one called Actos, two medical drugs. And we use the bee venom therapy for actually killing the Lyme bugs and putting the nerve growth factor on board and all that. And that together is a complete treatment, but it needs to be given for a long period of time. But it's very dramatic, how people stabilize with that. Okay, I think.
Announcements? Are you doing something tonight at 8 o'clock then?
Yeah, at 8:30 tonight, I suggest we show the rest of the video and talk maybe a little bit about the emotional component, practical steps of what actually can be done in a doctor's office. Not just some esoteric psychotherapy, but how I and Dino, how we very practically deal with patients on the table with their psychological issues and help people through that in a way that truly is healing. And like I said, we do have a teaching program, but it's nice to see that on a video, to see these things actually in action. We didn't show the neural therapy, we didn't show the actual procedures, but those of you who have taken the courses, you know how those look like. Okay, so my understanding with Chris is officially we break for the dinner break. At 6:30 is the
Wine and cheese party,
room
room 350.
350.
350 on upper level on this side of the hotel.
That's up the deck.
In the front of the hotel, room 350 at 6:30.
Okay. And it's now, what is it now?
We'll do some push-ups.
5:45. So it's in 45 minutes. And then those of you who still want to go to dinner afterwards, you have time at 8:30. Those of you who are interested, meet here.
8:30 back here, and right now I'm going to have one of the exhibitors lecture, Dr. Ripken, who does the autonomic nervous system testing. He's got some interesting things. Some dentists have used this device for detoxification. You might want to listen to it for about 10 minutes. So anybody who wants to stay, be my guest, and anybody wants to go, otherwise we'll see you.
Oh yeah, sorry, one more announcement. One more important announcement. This has to do a little bit about the dentistry and politics. We had a group in place over the last 10 years called AHP, which a couple of members of this group founded years ago as an alternative to American Dental Association. The ADA is a trade organization, and there is some antitrust laws in place. That means it is completely legal to have several trade organizations, and so we formed, it was very helpful to many dentists in the legal proceedings to be associated with this group. And however, the group became inactive over the last few years for various reasons, and now there is some pressure in the membership here to reinstate like a similar group with a similar intent, and one who rather sort of is a little bit sort of the spokesperson for us. And those of you who are interested in that tonight at the Wine and Cheese Party, to just kind of use that time to talk with Juan a little bit about that. And tomorrow in the evening break, we're going to have a more official meeting with those interested and seeing if we cannot make some firm decisions on that. Also, tomorrow we're going to talk briefly about IABDM, which we reorganized with the board of directors of this group, and in a very nice way, kind of looking at the future of how we can make the knowledge within this group more widely available. Yeah, so the political sort of arm of this organization, those of you who are even marginally interested, talk with Juan tonight to do some brainstorming, so tomorrow night we can have a little bit more of a concrete sort of meeting on that.
And I think when you say political arm, we're also talking about the legal defensive arm.
Legal defensive arm, yeah, sorry. Yeah, it's mostly about that. How can you as a dentist legally do all these things that you're learning here and be safe with it? And it's creating the safety net. That's really what this is about. And then we talk about IABDM and the new president and so tomorrow, yeah.